Hey, this is Dr. Miller here talking about rhinoplasty from New York City, and I want to talk about a topic that I should have included or probably could have included in another video that I did that I really encourage you to see, which is the top 10 reasons not to get a rhinoplasty. And I could have easily made this number 11, and that is don't get a rhinoplasty if what you want to do is make the nose feel smooth and soft as opposed to looking straight or smooth. Because the nose can be crooked and the nose can actually feel depressed or elevated, but the overlying skin can be absolutely straight. But the way that we feel the structures gives us the impression that the nose isn't the way it looks. And this video, the purpose of this video is to explain what I mean by that, okay? The first thing you have to understand is how we feel things. And different parts of our body don't feel things in the same intensity. Now this is called, believe it or not, it's called the homunculus. This is an actual a medical map, if you will. And this represents our sensory brain or our sensory cortex. And mapped onto the sensory cortex in the size to which its impact on our sensations is the size of the different parts of our body. So in other words, our foot, our toes, our ankles, they don't give our brain that much sensory information compared to our tongue. And our tongue actually gives us a tremendous amount of sensory input, and that's why children always put things in their mouth, because that way they can get a better appreciation for what it feels like, okay? But nothing gives our brain more sensory information than our thumb and forefinger. That gives us a tremendous amount of information, and that's why we can put our hands in our pocket and distinguish between a nickel and a penny. And it's funny, by the way, I was a first-year medical student, and I still remember to this day that the professor who taught us this, really sort of interesting character, and he used to draw using two hands, so that was really amazing. But more importantly, when he mentioned what I just said, he used the example. I could always tell the difference between a nickel and a penny because of the sensory input of the finger and the thumb. And I always use that example, so a shout out to my professor in medical school for that example. But as it pertains to rhinoplasty, this can be really deceiving, and this can be really confusing, and I want to give you that example. So here we have what looks like a pretty darn straight piece of felt going right across. But if you feel it, it's like, wait a second here, this doesn't feel right. It doesn't feel right at all, okay? Because underneath it, you actually have all of these jagged edges. And all of those jagged edges can be felt, there's no doubt. But, no pun intended, when you put the felt back on, it camouflages it significantly so that you don't see it, okay? And that's exactly what's going on with the nose. The skin thickness of the nose is varied along its length. And while you might feel something get depressed, right? While I turn around and I feel that this goes in or and comes up and goes in, while I feel that, the skin rebounds like this felt, and it doesn't necessarily, doesn't look that way. So occasionally patients will come in all the time and they'll say, you know what, I feel like this is, pushed in. And they're saying it literally that they feel like it's pushed in because it doesn't look that way at all. And what they're feeling is playing a huge role on what they think they're actually seeing, and it's not. So that explains a little bit about the homunculus, a great word. I still love saying it every time. Try it, you're gonna love it. And a little bit about how the homunculus plays a role in our perception of a smooth and straight rhinoplasty. Have a great day. This is Dr. Miller speaking to you from New York City. Looking forward to seeing you here in New York.